So let's revisit what you know about low or hypos. And remembering that we've said that it's almost unavoidable if you have good overall control of your glucose levels, so it's almost impossible to avoid it dipping on occasions in response to perhaps exercise or for younger children not having actually eaten everything that you carefully carb counted for. You'll already be quite good at recognizing some of the signs and symptoms that might indicate a low blood glucose. Younger children might not be able to recognize this in themselves, or maybe so engaged in what they're doing, for example, running around at play park, and not stop to recognize the symptoms. It's important to know that with the multiple daily injections, which is a more intense way of managing glucose levels, is associated with fewer lows overall. Here are some of the symptoms that you may be able to recognize. Feeling shaky, having wobbly legs, having color changes are commonly reported by parents or carers, as well as behavior changes. Sweating tends to be more in post-pubertal young people. And clearly some of these symptoms may not be related to low blood glucose at all in terms of feeling irritable or hungry. But it's important to check glucose levels to at least exclude the possibility. They can vary from individual to individual, and it's important to discuss these with the doc team, particularly if they have a relative hypo unawareness, as is often the case in younger children or in certain individuals. Here is some general advice on how to treat a low. We accept that for younger children, they might need less, and for an older teenager, they might need the full 15 grams. So perhaps think of it as a range between 5 and 15. Again, talk to the diabetes team and we can individualize that for your child. On screen are some examples of things that are very effective at correcting a low blood glucose. These include full sugar Coke. The small tin shown here, found on trains and planes, is around 12 grams, for example. Some jelly sweets, some glucogel, and some dextrose tablets. Fruit juice is often a popular choice as well, and it's easier for the child or young person to consume. Top tip would be to use a straw, and that's just to reduce your risks to teeth decay and dental health in general. It's also important to give the sugar treatment a chance to work. So we would always advise waiting at least 15 minutes, getting the child to rewash their hands to exclude any spilt fruit juice, for example, and rechecking to make sure that what you have done has had the desired effect to lift the glucose levels above 4. If it happens at one of your regular pre-meal glucose checks, it's important to deal with the low as the priority and to maybe delay the insulin. Popular urban myth and misconception is that chocolate or milk or bread are good for treating lows, and this is not the case. And that's because of the fat content delaying how quickly your body can get the sugar hit. So avoid these things. We'll talk briefly around the much more rare potential risk of a severe low blood glucose. This is often dictated by blood glucose levels well below 4, And actually, we know that the tools that we have don't measure glucose levels as accurately in the low ranges. So it's often more related to the symptoms. Some of the things that we've discussed previously that can precipitate a severe low is actually surprisingly having poor overall control and high levels can lead to more fluctuations in general and therefore lows. Lumpy injection sites, and for older children, alcohol is a discussion that we will have with you at some point when you're in clinic, when it's age appropriate to do so, or please just ask. So the treatment for a severe low, which is generally defined by needing third-party assistance, the child's likely to be uncooperative, if not slipping into unconscious state, by which point it's no longer safe due to the risk of choking of giving them any of the fluid or glucose options previously mentioned. We would advise, if in this rare event your child has a severe low blood glucose, has lost consciousness, and may even have a short seizure due to this, that you phone 999, put them in the recovery position, and if you feel confident and have it available from your repeat prescription, to administer the glucagon hypo kit. Depending on the age of your child, we can clarify how much of a dose you should aim to give. However, in those circumstances, it would not be unsafe to give the full amount. As a rule of thumb, if your child is roughly around the age of 8, you would aim to give roughly half the dose, and anything over the age of 8, the full dose. Please ask the doc team to show you a demonstration of how to assemble and administer this intramuscular injection. It's always important to call an ambulance as a backup. It's also important when we're discussing this anxiety-provoking prospect to emphasize how rare it is and why the emphasis on preventing, recognizing and treating lows and nipping it in the bud as such to prevent this potential situation. Again, for the vast majority of low blood glucose, they're easily treated.